Good afternoon, good evening, and welcome to our session on lessons from the COVID-19 response for shock-responsive social protection here in the region, the Caribbean, which is jointly organized by UNICEF and the World Food Programme. Welcome also to our panelists, our three panelists who have joined us here today. I'll introduce them in a moment. Here with me is Sarah Bailey, head of program at the World Food Programme office here in the Caribbean for emergency response and preparedness. And I'm Christina Dankmeyer, social policy specialist for UNICEF Eastern Caribbean Area Office, also based in Barbados. So we will guide you through today's session, which is a part of an overall e-conference on turning the COVID-19 crisis into an opportunity, what's next for social protection. And this is also an opportunity for us here to build stronger and more efficient social protection systems. And so we will be looking at the next steps for the Caribbean. And so our session will discuss two things. First of all, social protection efforts in response to COVID-19 to date in the Caribbean. And secondly, how we transition towards more medium-term support to address the socioeconomic impacts of COVID-19 and which opportunities there are to strengthen and prepare social protection for future crises and shocks. So to give you a better idea of the dynamic today, following a brief introduction by Sarah and myself on shock-responsive social protection in the region, we will hear from three countries and territories. First of all, Anguilla, secondly, Dominica and St. Lucia as well. Three distinguished speakers. We have permanent secretaries who have joined us today and will each present their respective perspective in 7 to 10 minutes. And then finally, we will reserve time for a Q&A, we promise, and also have a final response, final remarks by each speaker. And so please do send us any questions that you may have in the Q&A. You'll see the bottom button here, Q&A. We'll also be monitoring the chat, but please make it easier for us and use the Q&A button. Thank you so much. And I will hand over to Sarah for the first two slides.
Thank you, Christina, and it's a pleasure to join today. Before we start, we wanted to provide a bit of background and context on the impacts of COVID-19 in the Caribbean and also some of the measures being taken. Now, most of the governments in the Caribbean took early measures to reduce the spread of COVID-19 with curfews and either border closures or severely and strictly limiting travel. And this yielded important results on the health front, but the interruption in the commercial activity, the halt or very steep drop in tourism have resulted in cascading economic impacts. And early estimations by UNICEF in April found that in the Eastern Caribbean, countries had lost or were in the process of losing about 27% of their jobs. In July, a CARICOM Caribbean Food Security and Livelihood Survey implemented by the World Food Programme found that 7 out of 10 respondents had faced job loss or reduced income in their household. And those who classified themselves as having very low income, well below average income, for this figure was actually 9 out of 10. Now, every country and territory in the Caribbean has turned to social protection to lessen the socioeconomic impacts of COVID-19 and to support people who are facing these quite strong impacts. But as you'll see from this slide, shock-responsive social protection or adaptive social protection, now these may be new terms, but they're not new approaches in the Caribbean. There are examples going back more than 15 years of governments turning to social protection in response to hurricanes, in response to the 2008 financial crisis, and other events. But COVID-19 has dramatically increased both the number and the diversity of responses that governments are turning to be able to essentially use social protection to mitigate the impacts of these shocks on vulnerable people and others who have been impacted. And I'll hand it back over to Christina to tell you a bit more about these responses. And Christina, you're on mute right now.
Thank you. I'm muted now. So if we compare social protection responses globally with the ones here in the Caribbean, we can see quite a few similarities, but also differences. So in terms of similarities, we see the same trend across the board, that social protection is being used to respond to the immediate socio-economic impact of COVID-19. And secondly, we also see that social assistance accounts for the majority of social protection responses, with cash-based interventions being the most common one. But we also see a few differences. So when you look at the two in comparison here, the diagram, first of all, we see that in-kind responses, so for example, food assistance, vouchers, etc., are more commonly used here in the region. Secondly, social insurance actually features or focuses more on unemployment benefits here. And the types of measures that are most commonly used are actually listed here on the right side of the screen in the order of use, so the most commonly used at the top. And then thirdly, we also see that public works programs that are actually included in one category with waivers here are less common in the Caribbean. And so as you can see, most common are unemployment benefits, then we have temporary cash transfers to employers, same with recipients of social assistance programs, then in-kind assistance, and at the bottom, still used but not quite as often, temporary expansion measures. So if we go to the discussion now, so we have three key questions for you today, which we want to discuss. So first of all, what the experiences within the region actually are in terms of social protection already having been used for response measures, and what the emerging lessons out of that are. Secondly, as we are in the 7th month of the COVID-19 pandemic affecting the region, switching gears, so how can we actually transition from immediate efforts towards more medium-term support? And thirdly, what are the key opportunities to strengthen and prepare social protection systems for future shocks looking ahead? So we have three speakers today from Anguilla, Dominica, and St. Lucia. As you can see here, we've provided a little map for those of you who are not so familiar with the region. Anguilla as an overseas territory, and then the countries of Dominica and St. Lucia. And we have our three speakers here with us today that I'll introduce each one of them before they speak. So we'll do this in alphabetical order, and I'll start with Dr. Bonnie Richardson-Lake, who is the permanent secretary in Anguilla, responsible for social development, education, Ministry of Social Development. She is an Anguillan descendant born in New Jersey, US, also completed her education in the US and holds a doctoral degree in health education, worked at a hospital there for quite a few years in reproductive health, and also as an adjunct professor at Columbia University before moving to Anguilla in 2001. And ever since, she's been working with the government of Anguilla and was appointed PS in 2007. So I'll hand over to you, PS Bonnie, and I know you'll do a great job because I heard you also appeared on a television documentary once, so please go ahead.
Okay, I've unmuted myself. Thank you so much for this opportunity. It's a pleasure to be here, and I'll tell you a little bit about what has happened in Anguilla. As you all know, on the 11th of March, 2020, the World Health Organization declared COVID-19 a pandemic. So Anguilla, like other countries around the region, was faced with making the unprecedented decision of closing our borders mid-tourist season. So the closure of the borders marked the beginning and the continued closure of all major hotels and many restaurants, leaving many Anguillans to cope with high levels of unemployment and/or underemployment. While we're very happy to boast of only having had 3 cases, fully recovered, none requiring hospitalization, and no community transmission, the global COVID-19 pandemic has really led to extreme economic downturns and rising social vulnerabilities. As such, a social protection response was required to aid Anguillan families and the community at large. With UNICEF's With UNICEF's assistance, the government of Anguilla began to explore strategies for reaching the most vulnerable segment of the population. Vulnerable families with children were the first group of persons targeted for additional assistance. UNICEF assisted by providing funding to enable the Ministry of Social Development to expand our public assistance program. The objective of the UNICEF financial assistance was to further prevent a deterioration in the well-being of children and other vulnerable households under the Department of Social Development's Social Assistance Program. And that was, of course, in the immediate aftermath of the COVID-19 pandemic. All recipients chosen for the top-ups were existing program beneficiaries. This included all foster children who received double their usual benefit for a 3-month period. Additionally, families receiving cash transfers were provided with a one-off additional payment. School feeding beneficiaries, usually supported through the Department of Education, were provided with food vouchers while the schools remained closed. Our schools were closed from the end of March to the end of May. And then we continued the food voucher program through to the end of the year, to the end of the school year. These top-ups were managed through the Department of Social Development's existing social assistance mechanisms. The public assistance cash transfers and foster care recipients received their top-ups via their bank accounts, whilst the school feeding recipients collected and signed for vouchers at the department. Also to note, during this period, there were 2 unemployment benefit schemes that were implemented, one by the government of Anguilla's Ministry of Finance and Department of Labor, and the other through the Social Security Board. The unemployment benefit through the Social Security Board provided persons who previously paid into the system with EC $1,000 monthly. The government unemployment assistance program, which assisted persons who did not meet the criteria for Social Security, provided recipients with $800 EC monthly. While this assistance was originally supposed to end after a 3-month period, the programs were extended until the end of 2020. The most urgent task before Anguilla today, amidst an unprecedented dual economic and health crisis, has been to eke out a workable plan that supports the vulnerable, yet stimulates economic activity for recovery and sustained growth. The unfolding COVID-19 experience, in a time where reserves are already low as a result of the global financial crisis that began in 2008 and the devastation brought about by Hurricane Irma in 2017, has resulted in the depletion of the sinking fund and to finance debt repayments, and has exerted an upward pressure on public spending. Nevertheless, in addition to the measures described that the Department of Social Development employed, the government also implemented several other medium-term social protection measures. And this included things like protection against price gouging. There were some regulations enacted to guard against retailers raising their prices above market value. We also had a relaxation on customs duties for select medical supplies and cleaning supplies and food items. We also exempted persons from having to pay extension of stay fees for persons who were for lack of a better word, who were stuck in Anguilla because of border closures. They would normally be required to pay an additional fee to stay on. That was waived. Our development board has also provided low interest loans to medium and small businesses that were affected by the crisis. And we provided some additional support to some of our statutory bodies to make sure that they remained solvent during the crisis. There was also paid leave from work, and that was paid by the Social Security Board, even in absence of employer contributions. Of course, this had a lot of great impact on government spending. So one of the things we did was a supplemental appropriation bill where we reallocated expenditure to respond to the crisis, both for our recurrent and our capital. We waived Social Security and stabilization levy contributions for employers, and we provided some relaxation on some of the school policies that had financial implications. For instance, students weren't required to buy the latest versions of textbooks because this put an additional burden on parents. We also provided duty-free exemption on laptops for primary and secondary school students, because of course, during the school closure period, students would have been doing online learning. Despite these measures, though, it's clear that the sequelae of COVID will continue with us. As such, Anguilla and governments around the globe will need to begin to look to provide social protection well into the foreseeable future. The newly elected government recently decided to continue the unemployment assistance benefit into 2021 as a means of medium-term support. The continuous assistance is funded by the government of Anguilla at a rate of EC $1,000 monthly and is administered through the Social Security Board. Clearly, Anguilla will not be able to sustain this type of support indefinitely, which will require considerable reflection on how we best move forward towards strengthening our social protection systems and preparing for future shocks. While it may seem like common sense, COVID has really driven home the importance of preparedness in absence of shocks. Having systems in place prior to unexpected events ensures that the most vulnerable members of the population are able to cope, that programs are resilient, and very importantly, that they are shock resistant. Cross-sector collaboration, social protection mainstreaming, and targeted interventions are key to strengthening social protection systems. Scaling up our social protection programs flagged several flaws. Our focus going forward with the assistance of UNICEF will be on systems strengthening. So how do we ensure that our systems are positioned to best respond to future shocks? Well, COVID has taught us the importance of working across sectors in a collaborative response to these shocks. COVID first began as a health emergency, but as we learned, as in the case with HIV and AIDS, COVID has consequences that reach far beyond the health sector. So while colleagues from health, labor, tourism, and social security were planning a strategic response, it was a perfect opportunity for social protection policymakers to also come to the table. It became clear very quickly that a social protection response would be required and would need to work hand in hand with the other sectors. Now is the time to sit around the table to plan. Waiting until the next shock hits to plan can have devastating consequences. Collaboration across sectors as it relates to data sharing is particularly important. We learned that labor and social security, for instance, have important information that can assist the Ministry of Social Development in identifying and targeting potential beneficiaries. Additionally, because of their already existing systems, these agencies are readily available and readily able to collect information on the behalf of the ministry. Ideally, we can establish a system that would allow for seamless sharing of information to support a more joined up and targeted social protection response. While an integrated MIS may not be part of our short-term plan, there is definitely a need for a centralized electronic registry for social protection schemes. As sector integration improves, the need for effective online linked up databases will become increasingly important. Mainstreaming social protection will be a critical strategy in strengthening our ability to respond to shocks. This will include mainstreaming within social services and in the national development efforts more broadly. It means making social protection a cross-cutting issue in national planning. Social protection is often thought of as being just for the poor and the vulnerable. And while COVID definitely has highlighted the gap between the haves and the have-nots, social protection should in fact be seen as being universal. How we frame and how we deliver to target groups are different, but it is in fact for everybody. Collaboration and mainstreaming will allow us to more effectively target our interventions to ensure that those most in need are receiving what they're required and that no one is left behind. Anguilla's National Social Protection Policy, launched last year, highlights the importance of cross-sector work, mainstreaming, and targeting. And never has it been so critical to achieve these goals as it has been in the face of COVID. If there is a silver lining to this COVID pandemic, it's that it's caused us to take a look at our systems with a critical eye. It's signaled to regional and international partners that small island developing states can stand to benefit from technical and financial assistance that will not only help us through these difficult times, but will enable us to build resistant, more shock responsive social protection systems. This crisis reminds us that there is always a seat at the table for social protection. Social and economic development are intrinsically linked. No matter the type of crisis, there's always a role for social protection. Excuse me. In the aftermath of hurricanes and other natural disasters, in the aftermath of pandemics, really in the aftermath of any event that impacts national development, there's a role for social protection. We must be included from the inception and speak for those most vulnerable and unable to advocate for themselves. Let COVID-19 be a constant reminder of this. Looking ahead, it is with these lessons in mind that Anguilla will work with regional partners like UNICEF to strengthen our social protection systems. So, what is next for social protection? We in Anguilla will use COVID-19 as an opportunity to make necessary improvements to our social protection landscape. And I will end there. Thank you very much.
Thank you so much, P.S. Bonnie. Let me just turn on my video for one more time to properly introduce our next speaker, P.S. Burton, who is the Permanent Secretary at the Ministry of Youth Development and Empowerment, Youth at Risk, Gender Affairs, Senior Security, and Dominicans with Disabilities in Dominica. She actually used to be Permanent Secretary of Foreign Affairs for the past almost 4 years, and before also Permanent Secretary at the Ministry of Social Services, amongst other positions at that ministry. And she holds a master's in project management, postgraduate diploma in rural poverty alleviation, and a diploma in social development as well. So welcome, P.S. Burton, you have the floor.
And thank you for the opportunity to participate in this discussion. Can you hear me?
Yes, very well, thank you.
Okay. As you are aware, Dominica suffered from the devastation of Hurricane Maria in 2017. And as we were making strides in the development process of our country to rebuild this nation, here comes COVID-19. And so it posed an additional problem, if I may say, for the continued development and assistance to those who are most vulnerable in our society. Dominica suffered quite heavily from the effects of Hurricane Maria. And so 95% of our households our houses were destroyed. And so the government of Dominica had embarked on this housing program, this infrastructural program, to try to rebuild the country. And when we thought we were just about to take off, as we would say, here comes COVID-19. And so government decided that we would, for a period of time, continue with the infrastructural development. But keeping in mind that COVID-19 was here and preparations had to be made. And so several programs were implemented by the government of Dominica to address the needs of the nation, especially to assist our vulnerable people. Most of the programs designed to meet the needs of the vulnerable at the different stages of their life cycle. This can be categorized as social assistance, active labor market interventions, or social security. The portfolio of programs work together to deliver resilience, equity, and opportunity. So whilst we were preparing and doing all what needed to ensure that Dominica did not suffer too much from COVID-19, we were also preparing because we know very soon we would again be in the hurricane season. As my sister from Anguilla mentioned, we are always faced with the matter of having hurricanes annually. And so while preparing for COVID, we also had to be preparing. And so a task force was put together to assist in ensuring that we were prepared for COVID-19, for the arrival of COVID-19, because it was inevitable. However, we were also preparing for the hurricane season. And so government's infrastructural program, building resilient houses for our people, continued, as well as quite a bit of work was done in ensuring that we built whatever needed to be done to have the space prepared in the event that we had a case of COVID-19. And so the health sector received quite a bit of money. $22 million was placed into the health sector to ensure that we had a facility at the airport. We had other facilities where persons who would have gotten ill via COVID-19 were sent to the second town in Dominica, and so that is in the area of Portsmouth. And so we had to build this facility to ensure that the services that were required were prepared. The key areas of intervention by government included infrastructural development, a total amount of over $2.2 $298 million was put into the infrastructural development. In the area of healthcare, $22 million was placed in the healthcare program to ensure that everything was in place. The equipment was at the hospital, the medication was available, protective gear was on island, and also cleaning supplies. Government also zeroed the tax on the import of cleaning supplies. Government provided income support a 3-month period for heads of households as well as persons who were unemployed due to COVID. When we closed the country, we know that Dominica is a very small economy, and so you had so many people who were unemployed because we depended so much on the tourism industry. And so a lot of our people were employed, and government decided the government was going to give the head of households as well as all those who were unemployed some assistance for a period of 3 months. In the agricultural sector, I think government did a wonderful thing in that the government decided that it would implement a short crop program. And so every family was asked to register. When you registered, you were given what amount of plants that you could grow. So for example, in some instances, people had their 2-story buildings. They now had the top of that 2-story building being developed into a small farm. So they would have the old fridges and so put soil into them and have farms built. Government gave all the plants. So everybody who registered got the plants. Government then gave some input so that the farmers could grow, or even people who were not farmers, public officers, and everybody got involved in growing some kind of crop for food safety. And so quite a bit of work was done in that area. However, government also got some monies from the World Bank in the amount of $10 million to assist the larger crop producers as well as livestock farmers. Another thing that the government did was to implement a program where all the fresh produce that was produced by the farmers was purchased and given to other families who were not farmers. And so every week, the government distributed foods, especially in the town areas, to ensure that the families received food. Government again did a tax rebate of 8%. They reduced the corporate income tax by 8% for the periods of 2019 and 2020, because during the month of March, that's when you have to submit your returns. But because of COVID, government decided that they would do an 8% reduction. Government also implemented a small business support program at the Aid Bank in Dominica for small business owners and the micro business owners. They could go to the bank and access $15,000 at 1%, and they had a whole year before they would begin to pay. A number of other initiatives were implemented with our partners. For example, we received assistance from the World Bank, from UNICEF, from OECS, from the UNDP Engender Program, from UN Women, and lately from the World Food Program. Those assistance would go to the most vulnerable in our society. And so we had a registration process where a number of persons came and registered, and we go through the process of selecting those who are most vulnerable. As I mentioned, a lot of people lost their jobs. Some people were domestic workers and all of that. They lost their jobs, and so it became very hard for them to cater for their families. Government, again, after we had our first case of COVID in March, government decided to close the schools. And so government had to provide laptops to the students to ensure that they would do online classes. As I mentioned earlier, Hurricane Maria had destroyed Dominica, and so internet was a problem for a lot of the schools. There was no internet service, and so government decided that it would implement a program where all the public buildings in Dominica would be equipped with internet, so that students as well as other community people could access internet. And so laptops were given to students so that they could continue their education, their online learning. Government also assisted with school vouchers, because we have now open school, and so government knows that people are unemployed and so on. They've given vouchers so that students can purchase their uniforms, they can receive all their textbooks, their school fees are being paid, and government is assisting in that area. Under the World Food Program assistance, cash transfer assistance, we are giving a top-up, we call it a top-up, to the public assistance recipients, to all public assistance recipients, as well as foster care children and households. We are also assisting the fisher folks. Sometimes we forget these people. The fisher folks and the fish vendors, who are very important people in our society, whose livelihoods were disrupted because of the curfews that were placed on the country. And so we are also looking at assisting these people, the small craft vendors who would make the crafts and sell to the vendors at the tourist points. There are no tourists now, and so we are also going to assist them. So a number of programs were put in place to assist the most vulnerable in our society. To date, Dominica has recorded 32 positive cases of COVID-19. There are 26 recovered cases, and we have a few who are still at the center, but most of them have recovered. Thank God we have no deaths in Dominica thus far, and we continue to work. But some of the lessons that we have learned based on both Hurricane Maria, looking at disaster risk management, and of course COVID-19, we can also say that COVID-19 is a disaster. We look at some of the areas that we need to strengthen, coordination between disaster risk management, social protection, and other sectors through linkages with national plans and other cross-sector strategies. For example, the Engender program worked within another ministry to provide assistance. UN Women worked within a division within my ministry to provide assistance. So we all have to collaborate and coordinate, and so we can be able to reach more persons. We have to share lessons learned and training experience so as to build awareness and knowledge. And most importantly, we have to work with our partners, other partners, to strengthen the social protection program. Yes, we know that we do not have all the financing that is required, but if we work with our partners, they can assist us in giving technical and financial assistance. I would like to stop here and continue the discussion. Thank you.
Thank you very much, P.S. Burton. So let me just share the screen again real quick, just so we can introduce our next speaker adequately as well. We're now moving to the third speaker, P.S. Belda Joseph. She's the Permanent Secretary for Social Justice, Local Government and Empowerment. Equity is in there too. I think it's not on the screen properly. And P.S. Joseph actually has quite a strong connection to disaster risk management as well, as she previously served as the director of St. Lucia's National Emergency Management Organization, NEMO, from 2014 to 2018, where she was responsible for coordinating emergency responses and also programs that build resilience and decrease risk. And she was also involved in the hurricane response to Hurricane Ivan in Grenada, and an EU-funded project administered by SEDIMA, the regional Caribbean Disaster Emergency Management Agency, and she holds an MSc in Water and Environmental Resource Management from IHE in the Netherlands, as well as an MBA from UE Cave Hill here in the region. Welcome, P.S. Joseph, you have the floor. Just unmute as well.
Thank you very much, Christina. Good afternoon, everyone. Thank you for the opportunity to share some of what we're doing in St. Lucia in response to the current challenging environment that we have found ourselves in. I Okay, great. Thank you. I was wondering whether I had to do it on my own. All right. So the presentation outline is very, very brief, detailed on the screen here. Introduction, some thoughts on the impact of COVID-19 on St. Lucia. We're going to then look at the response actions by the government of St. Lucia, those specific to the Ministry of Equity. And then we will look at some more substantial matters where we look at how we transition towards medium-term support, and of course, opportunities for strengthening social protection for future shocks. Right, so this is really just to provide some context for what I will be discussing. St. Lucia has a population of about 180,000 persons, 25% of whom is considered to be monetary poor, and that is according to the SLC of 2016. And I would like you to just keep that percentage in mind. The island is also very highly vulnerable to a number of impacts, and I'm stressing on multiple impacts here because oftentimes in the Caribbean, we focus on the impacts of natural hazards. But as COVID has taught us, it is really about multiple impacts and planning for multiple impacts. And of course, COVID has also shown us that a non-natural hazard impact can have very severe negative implications for all sectors of the economy. And we're looking at the social, the economic, the health, and well-being. All of the sectors within society could be severely impacted by those hazards. Right, so let us look at some of the impact of COVID-19 on the St. Lucian economy. Of course, like the rest of the Caribbean and many other islands beyond, we have witnessed disruptions to livelihood, high unemployment rates, and of course, we also expect increase in poverty levels. I just want to share with you pre-COVID unemployment rate. We were at 21%, preliminary percent during COVID and post-COVID. Similarly, with poverty, as I said earlier, we had a 25% poverty rate was recorded in 2016. And post-COVID, when we do our simulations, we do really expect to see a doubling of our poverty rate. This is really shown on this slide that I've put on here, where it just speaks to the data that UNICEF has compiled and the conclusion that they've drawn in terms of St. Lucia moving from a 21% to a 44% unemployment rate, which of course can be significant and can pose serious challenges for St. Lucia and the government of St. Lucia. Right, so I did speak about the modeling as it relates to poverty. 25% poverty in St. Lucia. If we model a 25% income shock, we realize that our poverty rate can jump up to 41.3%. And if we model an income shock of 35%, we see that going over half of the population of St. Lucia being poor. That is significant because that speaks to the measures that we put in place, that speaks to social protection, that speaks to policies of the government of St. Lucia as we recover and as we try to build resilience. So I'll just touch a little bit on additional impacts, decline in revenue as a result of our economic pillars being significantly impacted. We are tourism-based, tourism-reliant economy, and with border closures, with limitations on travel, of course, we expect to see a decline in revenue into St. Lucia, loss of income as a result of loss of livelihoods. And I want to just touch on the last one because we, over the years, have seen quite a bit of remittances being returned to St. Lucia by St. Lucians living overseas. And so what we expect is a significant decline in that. And that, of course, would assist with household incomes. And if we don't have that household income, we do expect challenges and greater need for social protection in St. Lucia. So that slide really shows you the increase in remittances over the years up to 2018. And of course, as I said, we do not expect to see an increase here. Psychosocial impacts. This is one sometimes that we overlook, we don't really talk about, but we do anticipate negative impacts on people's well-being, on people's mental state. And it's one of the things that we have kept at the forefront because we want to ensure that we can provide support to persons who are in need of psychosocial assistance. And of course, I think the latter one here, or the last one here, many persons would be familiar with this, as we've seen serious increases in the demand for social protection. There are so many people coming to the offices of the ministry looking for all forms of assistance, a wide range of assistance, housing assistance, food assistance, income support. It's just a wide range of assistance and a growing list of persons requiring that type of assistance. And so what have we done as a result of these complications and these emerging threats that we have seen? One of the things that we've done from very early was to expand a number of our programs vertically. Our foster care program, our child disability grant program, our social assistance program for persons living with HIV, all of these benefited from a top-up. In the case of foster care and persons benefiting from the child disability grant, which is a universal grant, we provided an increase of 100 Eastern Caribbean dollars for 3 months, and that started in July and ended in September. I have to thank UNICEF for that support. With respect to the persons living with HIV, we have 88 persons on that list. That moved from 100 to 300 persons, a top-up of $200, and that is for a period of 6 months. So that started in July and will go on till December. And of course, I have to thank the World Food Program for providing that assistance. Just to indicate that for foster care, we have 183 beneficiaries on that list. And for child disability grant, we are looking at 312 persons. We also undertook a horizontal expansion of the public assistance program, and that is moving from 2,600 households to 3,600 households. So we are actually increasing by 1,000 households. I have to also thank the World Food Program for that initiative. But beyond the support of the World Food Program, the government of St. Lucia will continue to support this addition to the public assistance program. We rolled out an income support program for non-NIC contributors, where we paid 500 Eastern Caribbean dollars for 3 months for persons who had lost their jobs as a result of COVID, but were not eligible to benefit from the economic relief program of the NIC simply because they were not contributors. We have 4,868 persons who benefited from that at a cost of just close to 7.3 million Eastern Caribbean dollars. This month, we are rolling out our electricity assistance program, which really seeks to provide qualifying households electricity bill credits to the tune of $75 for 6 months. We had a hot meals and food distribution, food packages distribution program. That one has ended, but we partnered with the Office of the Prime Minister and the St. Lucia Hotel and Tourism Association for that particular activity. We received an additional $3 million for our educational assistance program from the government of St. Lucia to allow us to deliver educational assistance, needed educational assistance to eligible households who will come into the St. Lucia Social Development Fund for this assistance. And of course, through the Division of Human Services, we are providing psychosocial support to persons in need. We continue to do that through that division and through that ministry as well. We have a counselor on staff at the ministry. Right. So from response to recovery, all of these were as immediate response activities. So what are we doing as we speak about recovery and as we speak about resilience? One, we are looking to strengthen our human capital by increasing training and skills enhancement. There may be persons who require retraining. There may be persons who require transition into other forms of employment, and we are seeking to provide or to support such initiatives by ensuring that we provide training and skills enhancement to individuals. We're looking to strengthen our micro lending institution, and we specifically focused on the Bell Fund. The Bell Fund really provides small loans to individuals for entrepreneurship. And we're looking to see what package can we put together to allow for an expansion of the target group that Bell Fund is currently servicing. Establish or strengthen public workfare programs. So we're moving from welfare to workfare because we want to stimulate economic activity at the community level. And by this, we're looking at small initiatives such as the implementation of infrastructural works at the community level. How can you make it labor intensive and ensure that you engage persons in the community to undertake such works? We're looking at a review of our national insurance system to explore options for unemployment insurance. We do not have this at the moment, but we've looked at what happens in Barbados and we think that is an option that could be feasible and in response to shock. Promoting backyard gardening for food security, making sure that you can augment your food bill because we do know that income is a challenge. We will continue to provide psychosocial support to persons in need. And of course, we have a huge reform program for our social protection system. And we are making sure that it is shock responsive, that it considers gender issues, and that our system is inclusive. That reform is being supported by the World Bank as well as the UN system. The UN system is funding it through the SDG Joint Fund Initiative. Opportunities for strengthening social protection for future shocks. We see an opportunity for reviewing and updating our system, as I said, so that it could be more shock responsive. We're looking at our policies. Our social protection policy was approved in 2015. We are looking at it to make sure that it is shock responsive. We are looking at our legislation, our delivery processes. How can we leverage what we have currently and how can we improve it to make sure that we can adequately prepare for and that we can respond to shocks? We have an opportunity for integrating technology into our social protection platforms to make it more efficient as we deliver the required services. How do we do that? We need to establish a social registry. We have collected a lot of data. How can we begin establishing that registry? And how can we establish complementary data management systems to support our decision making in a very timely manner? And coordination, I heard it from my colleague from Dominica. How can we ensure that there's coordination and planning and for preparedness, for mitigation, for response, and for resilience building? We need to make sure that we can coordinate and that we are preparing for a sector and that we can respond adequately to any shocks that can happen. And I think that is my last slide. Thank you very much.
Great, and thank you so much for all of our speakers for that insightful information. And we're moving on to question and answers, and there's been a couple that have been posted. One that we wanted to start with is, for each speaker, is essentially in 2 minutes or less, what's a key challenge that you've been facing with using social protection in response to COVID-19? And for this, we'll go ahead and start with P.S. Bonnie.
Excuse me, challenges. Of course, I think the universal challenge is always funding and resources. How do you find the resources that you need to provide the services that are required? And I think the other issue that was flagged up for us is the sort of the tracking and the monitoring of our beneficiaries. And I spoke about developing a system where we can communicate across sectors about people who receive social protection services, so that we know that we're not duplicating and so that we're actually targeting and getting to the people who need the services. So I think one of the challenges that flagged up for us is, and I guess you can flip it and say it's not a challenge, but one of the things that we discovered, because it's relatively easy to do, is that we must collaborate more with our counterparts in other sectors. So that was a challenge. I think also responding quickly and getting the services out there to people who needed it quickly right after the COVID crisis struck. So looking at how to prepare so that the next time a shock comes along, you're ready as soon as it happens.
Thank you. And P.S. Burton, what are your thoughts on some of the challenges of using social protection in response to COVID-19 in Dominica?
Okay, I think that the lack of sufficient data to readily or quickly respond to the needs, that was definitely a challenge for us. So we had to, for example, under the WFP program, we had to go into the field and within 2 weeks collect as much data as possible. But the good thing for us is that we did it digitally, and so we can utilize it later. The whole question of coordination and collaboration among the various agencies was also a challenge that we noted. And of course, the fact that we are small economies, we do not have sufficient resources to respond quickly and to respond to all those in need. So these were the challenges that I encountered thus far.
Thank you very much. And that begins to actually touch into a question that was just posted as well about some of the opportunities around data. P.S. Joseph, where do you see some of these key challenges that you're facing in St. Lucia?
Right, so I will speak to two key challenges. One being the ready access to resources that was not forthcoming immediately, and so that delayed our response in providing services, much needed services to persons who were coming to the ministry at the time for support. And the other one relates to data and the availability of data in a format that it could be readily used for the decisions that we needed to make. I have to indicate that we received support from the UNICEF to allow us to manage, to put our data in a form that we could manage and we could easily retrieve what we required. But initially, we really had to sit down and go through a lot of information to be able to pull out any information to respond accordingly. So these were our two challenges.
Thank you for that. And I would like to build on, you know, both P.S. Joseph, almost instantly turning this back to you, and then with P.S. Burton, we had a question that was specifically about data, and it was really asking, you know, the extent to which, and apologies, I'm having trouble opening both of the windows at once, but it was really asking, to what extent can the data being gathered from the responses to COVID-19, so perhaps some of this new data, be used to establish or contribute to social registries or beneficiary registries. And so P.S. Joseph, I know you just finished, but why don't I put that back to you, and then we'll follow up with P.S. Burton on that.
I think it provides a really perfect opportunity to pull all of that data together to begin the establishment of a social registry. I will share that for us in St. Lucia, we are in a fortunate position because we are about to start the Human Capital Resilience Project. We're about to implement that. And so we are in the process now of doing a complete recertification of all of the persons on public assistance. We are also looking to expand the public assistance program, as I mentioned. And so anybody who's coming into the ministry, they would be subjected to the application process. Just to quickly mention that we have a targeting tool that was approved by the government of St. Lucia in 2019. It is the tool that is supposed to determine eligibility for all government social assistance programs. And so we put everybody through that. It has a lot of information from electricity account numbers to water to household data. And so we have all of that information that we can now put together to establish a social information system, which is what we intend to do further down the line under the Wilburn project. So it's a great opportunity now.
No, it's great to hear about this. And for Dr. Bonnie Richardson-Lake, we're going to pivot a little bit for you because someone had a specific question, and it was essentially asking, given the importance of tourism for Anguilla's economy, and has COVID prompted any thinking about diversification to alternative economic activities? And is there a role, productive role for social protection contributing to this, for example, through reskilling labor force?
Yeah, that's a great question. And actually it's economic diversification is something we've been talking about for over a decade now, because we are so extremely reliant on tourism. But COVID has again flagged that up as a major issue, as a major area to further develop. And one of the things we're looking at now is a free economic zone in Anguilla, and also looking at scaling up fisheries and agriculture as a way to further diversify the economy. Again, tourism has been key throughout, but we really recognize, particularly with the borders closed and the hotels closed, that we really need to look at some other areas for further development, which leads to the second part of your question, which had to do with sort of retooling and re-educating the population. And that is something that we're looking at. In fact, we're looking at the offerings at our community college to look at how persons who are in the field already can sort of retool and reskill for other areas. So that is a big area of importance for us.
Okay, thank you so much. And we're drawing to a close in about 3 to 4 minutes. And there's been a lot of great questions, and I'm sorry that we can't get to them all on, some important themes about sustainable and increasing access or the financial resource base for social protection. Some of the debates related to that, as well as some of the coordination questions, and even the issues of gender and the gendered impacts of disasters and COVID-19. And we can't wrap this all up into any final thoughts, but I would like to ask you in about 30 seconds or less to provide just a closing thought, a takeaway, a message of your choice to the audience related to our discussion today. And we'll go ahead and start with P.S. Bonnie Richardson-Lake and go
Okay.
Burton and then Ms. Joseph. Apologies, that was important.
Yeah, I think sort of the takeaways, and I think I mentioned them in my presentation, really have to do with cross-sector collaboration, mainstreaming, and targeting our interventions. And I would add to that, because I didn't speak to the importance of psychosocial support in my presentation, but we've done a lot of work around that area, particularly as it relates to gender issues. There have been a lot of stresses for women throughout this whole COVID pandemic, and we've done a lot of support around that. But I would say my take homes are really using this as an opportunity to strengthen our systems and to look at how we mainstream, how we work better collaboratively, and how we target our interventions.
Oh, thank you so much. And P.S. Burton, a closing thought or an angle that you would like to leave the audience with?
Okay, so my closing thoughts. I see that we all across the board, those of us who discussed today. Okay, so I am saying that I see the need for collaboration across the board, across all sectors. Also, the question of targeting is something that is very important, and the collection of data, and having that data readily available to be used when necessary at the quickest possible time. I am also taking away quite a bit from the sharing that was done by my two other colleagues, and I hope that we can work together across, even if we're from different countries, but we are in one region, and maybe we can share some of the information so we see how we strengthen one another as we move, ensuring that we have proper social protection strategies in our various countries. So thank you.
Thank you. And P.S. Joseph, for the final word from our esteemed panel.
Thank you. For me, social protection is a fundamental human right. And I think we need to look very seriously at how we can leverage the opportunities that are provided by an effective social protection platform to help vulnerable persons to prepare for, to deal with, and to ensure that they can mitigate the impact of hazards. We also want to ensure that we can use social protection, the broad umbrella of social protection, to help vulnerable persons build resilience to any shocks, not just natural hazards, but any shocks that may present itself. And so for me, I believe at the end of the day that this is the way to go. We have to leverage the opportunities that social protection presents to help our nation build resilience.
Well, that's a powerful message to finish on. And I really want to thank our three panelists, our three speakers, for sharing these insightful experiences, as well as my co-moderator, Christina. If there's more information that you would like to get about some of the experiences and evidence and research that these governments, but also other governments in the Caribbean, are their experiences with shock responsive social protection, please reach out to us. And don't forget to join tomorrow for some of the upcoming sessions, as well as completing the survey related to our session to let us know what you thought. And thank you so much for coming today, and have a wonderful rest of the day or evening. Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you.